Hello radiographers, hope you're doing good. Welcome to another tutorial video, and this is the fourth video of my contrast X-ray playlist. And previously I have uploaded about IVU, barium swallow and barium meal, and this is the next tutorial is about the barium follow through. So hope you will enjoy it. So without further ado, let's start. So at first, what is the barium follow through? So barium follow through is a X-ray of stomach and small intestine, and that uses barium based liquid, that is barium sulfate solution, and we used it previously in barium swallow and barium meal. So this is the same materials we will use for this, and in this barium follow through technique, images are taken over a period of several hours to track the barium inside the small intestine. And sometimes it's called barium meal follow through because barium meal also taken with the follow through. So doctor can advise barium meal with follow through and also can advise only barium follow through. So but you have to take barium meal also during the follow through. Start with the barium meal and then followed by barium follow through. And small intestine or small bowel ends at the ileocecal junction. So the last line is saying this. So now let's look at the anatomy. So here you can see there is a human body, and here is the our gastrointestinal tract, the esophagus, stomach, and here small intestine starts at the pyloric end of the stomach with the duodenum, and then the jejunum and the ileum. And these three parts consist small intestine, and then right here is the ileocecal junction where the ileal part ends and cecal part starts. So it is the longest part of the alimentary canal, and it extends from the pylorus of stomach. So this is the pylorus of the stomach and ends to ileocecal junction. So here where the large intestine starts at the cecum, here it ends, and it has three parts: duodenum, jejunum, and ileum that I told earlier. And its length is total small intestine length is 6 meter, and the diameter is 2.5 to 4 centimeter. So if we look inside the small intestine, so we can see there are circular folds inside the intestinal wall, but there are three different types of folds. You can see that this is the duodenum, this is the inside duodenal wall, and this is the inside jejunal wall. And in jejunum wall, you can see there is the rudimentary structures, and it's called the intestinal villi. And also there is ileum inside the ileum, and there is aggregated lymphoid nodule, and that's called the Pierce patch. And if we cross section the small intestine, we can see that there the small intestine wall have four layers, and the innermost layer is called the mucosa, and in the mucosa there is the epithelium and connective tissue. So this part is called the mucosa, the innermost part. And below this the submucosal layer, and then the thick muscle layer, and then serosal layer. So these are the four layers. One is mucosal layer, and then submucosa, and then muscular layer, and then serosal layer. So here is the cross section. You can see that in the mucosal layer, inside the mucosal layer, these are the villi, intestinal villi, that helps to move the food to the large intestine during the peristalsis movement. So hope you have a good concept of the anatomy of the small intestine. So let's go to the technique of barium follow through. So there are some indications why doctors advise barium follow through, and the number one is the abdominal pain and diarrhea, and then small bowel obstruction, and it's a common reason, and then Crohn's disease. And Crohn's disease is a vital factor in small intestine pathology, and we'll see it. And then nasogastric tube failed intubation, and then malabsorption, anemia, gastrointestinal bleeding, and suspected abdominal mass. So these are the common indications for barium follow through, and there are some few contraindications like colonic obstruction. So if the patient have a complete obstruction of the colon, then barium follow through is contraindicated. And then suspected perforation. So if there is suspected any leakage of the small intestine, and then perforation happens, and it's a contraindication. And then a paralytic ileus. So paralytic ileus is a temporary and non-mechanical stoppage of intestinal contents caused by the loss of the normal muscle contraction that move food through the digestive tract. So these are three main reasons for the contraindication of barium follow through. And let's introduce the contrast media. So contrast media here is a barium suspension, and it's a medium density solution that is 50 to 60% weight per volume. So that means a 100 milliliter solution will have 50 to 60 gram barium sulfate powder. So here you can see that there is a ready-made solution available, and it's called the liquid easy pack barium sulfate suspension. There is 60% weight volume and 41% weight per water. So this is a good example. And then sometimes, yeah, you can use suspending agent like carboxymethyl cellulose or xanthan to prevent flocculation and maintain stability. So what it means? So mixing suspending agent that so that heavy barium particles don't settle too quickly at the bottom. So it helps to spread the barium particles to whole of the solution, and it reduces the chance of settle down of the barium particles. And then high density barium 200 to 250% may produce an appearance of fold thickening and clamping of small bowel. So this is the reason why the high density barium should not be used. So if you don't have the ready-made solution available, so you can make it manually. So you can make barium solution manually like this. So here I take 2 glass, and first I fill up the glasses in half, and then pour 100 gram of barium sulfate powder in each glass. So 2 glass total have 500 milliliter of solution, and then mixed and fill the glasses with water, and then stir it with the spoon so that the barium mixed with the water, and keep stirring. So barium is a water insoluble substance. So but you stir it properly, it will spread through the water, and it looks like a milk, 2 glasses of milk. So that's the procedure. And why barium is used? Because it is an insoluble material. So barium is insoluble to water and it has a high atomic number of 56 and high density, and it works as a positive contrast in X-ray and of course radio opaque material, so that we can see in the image as bright. And barium is not absorbed or metabolized in our gastrointestinal tract, and the barium sulfates are eliminated from the body, and alkaline barium sulfate suspension improve protein valvuli. So these are the reasons. And why not the iodinated contrast? So what because iodinated contrast are water soluble and they absorbed by the intestine very quickly, and there are side effects of iodinated contrast. And now the patient preparation for barium follow through procedure. The fasting for 6 hours or overnight fasting is necessary. So it's best to ask the patient to take overnight fasting. So take dinner at night and then keep fasting at the night and at the morning, and then come to the hospital fasting, and then eat only low fiber residue diet the day before exam. So before the day of the exam, patient should only eat low fiber diet or low residue diet that digest quickly, and two laxative tablets can be taken before the night. And laxative tablets helps to clear the bowel quickly, and patient should drink plenty of clear fluids throughout the day. And in the hospital, before the procedure, patient will wear a hospital gown. And now the steps of the technique. So at first you have to take a control film of the whole abdomen in erect position, and of course it's a AP view. So control film is important to show the condition of the abdomen preparation of the patient, that is there any gas, major gas obstructed in the intestine or any food substance. And if the control film is okay, then go to the next procedure, and then ask the patient to drink 2 glasses of barium solution, and it will be 500 milliliter solution and 200 gram barium powder, and then take a barium meal X-ray and erect AP position. So you can see that there is a image of a barium meal and X-ray of stomach, and the stomach is filled with the barium solution. This is the barium meal image after the drinking barium sulfate solution. And then take another barium meal X-ray in T position, that means tendon bar position, that means a head down position. And in this position, the barium sulfate solution will goes to the fundus, and the whole stomach will be filled with the solution. So this is the second image after drinking the solution, and it's a barium meal image. And then again a barium meal image after 5 to 7 minutes, and it's in left posterior oblique position, and it is for showing the duodenal bulb. So in this image you can see that the barium is crossing the duodenal bulb and enters to the duodenum, and this is the position, left posterior oblique position. And then after 15 minutes take another X-ray of stomach, and it's again left posterior oblique position, and it's to show the duodenal bulb and loop more clearly. So in this figure you can see that the contrast is passing through the duodenal gap and enters into the duodenum, and also contrast reaching the small intestine. But still, stomach contains a large amount of barium sulfate solution. But here is that you can see the duodenal cap very good, and it's the pyloric end. So this is the pyloric end of the stomach, and this is the duodenal cap. And now after 1 hour, take a image of whole abdomen in AP supine position. So this is the abdomen case, and this is the first image of the barium follow through, and you can see that the contrast spreading through the small intestine, and this is a 1 hour image. And then after 2 hours, take another X-ray of abdomen in PA prone position. So in this time, it's prone position in PA, and prone position helps to spread the small intestine and reduce the overlapping of the intestine. And in this image, you can see that barium passes the stomach and spread through the small intestine, and it's a 2 hour image in prone position. And then after 3 hours, take another X-ray of abdomen and PA prone position, and you can see that the contrast have goes through the all the small intestine and start to reaching the large intestine. So this is a 3 hour image. And take another image in 4 hours in left posterior oblique supine position to visualize the ileocecal junction. So now contrast reaches the ileocecal junction and enters into the large intestine or ascending colon. So here is the ileocecal junction, and you can see that the contrast is goes to the ascending colon. So this is a 4 hour image. So within 4 to 5 hours, contrast reaches the ileocecal junction normally. So after 4:30 hour, take another X-ray of abdomen in left posterior oblique supine position to visualize the ileocecal junction. So take another X-ray of or spot film of ileocecal junction, and you can clearly see that this is the last end of the ileal part, and this is the cecum part. So this is the ileocecal junction here, and contrast filling the ascending colon. So at this time, you need to compress ileocecal junction area by compression cup of the fluoroscopy machine to remove the overlapping intestine. So that means that in normal position, the intestines may overlap in each other and obscuring the ileocecal junction. So you need to use the compression hand of the machine and compress this ileocecal junction part of the patient so that the other small intestinal parts move from this and ileocecal junction sees clearly. So here is a fluoroscopy machine. So I add this fluoroscopy machine to visualize you the compression hand. So this is the compression hand. So this is a fluoroscopy machine, and you can see that this is the compression cup, and by a control panel or control board you can drag this cup out of this, and it goes anterior and goes down and give compress to the abdomen of the patient. So here I zoom in the ileocecal junction. So as the barium passes the ileocecal junction and enters into the large intestine, and you can visualize this barium follow through procedure ends. So that means when the contrast passes the ileocecal junction and enters into the large intestine, your study is finished. And then you have to take 4 spot frame in this ileocecal junction in different compression, different degree of compression. and it may take 6, 12, or 24 hours to reach the ileocecal junction, and it depends on the condition of the patient's peristalsis movement. And keep taking images at 12 hours interval as long as it reaches the junction. So sometimes you can see that after 6 hours, contrast didn't reach the ileocecal junction, and even 12 hours contrast didn't reach the ileocecal junction. So you have to take image in the next day or 24 hours image to see how the contrast reached the ileocecal junction. And there are some tips for you that you can overlap of contrast filled bowel loops in pelvis overcome by table head down. So if you head down the table, so contrast overlapping will remove. So bowel loops overlapping will remove, and you can use 30-degree caudal angle view of pelvis and emptying urinary bladder prior to filming ileal loops. So you have to ask the patient to empty his urinary bladder to visualize the ileal loops clearly. And then you can also use some technique to increase the peristalsis movement. There are some medicine like metoclopramide, neostigmine, and glucagon. And then also 20, you can add 20 to 40 ml of sodium or megluminosis diactozoid or gastrography into barium, and it inverts the transit time. Sorry, it will be increases. It increases the barium transit time into the small intestine, and you can also use cold water, and it improves the barium more palpable and speeds gastric emptying. And there are some complications of barium. The first one is barium can be leak through the small intestine, and because of the perforation, and there may be barium infection, and for this appendicitis may occur, and there is maybe aspiration. So there barium maybe goes to lungs by any tracheoesophageal fistula, and there a pneumonitis or chronic infection of lungs can be occur, and then allergic reaction, and then constipation, a common complication, and then abdominal discomfort or cramping, and nausea and vomiting. So these are the common complications may happen. So first 3 or 4 are serious complication, and last 3 are non-serious or general complication. And you have to care the patient after the procedure, and you have to warn the patient that the stools will be white for a few days, and after some days it will be flush away. And you have to ask the patient to drink plenty of fluids or clear water, and the patient should be advised to eat and drink normally to avoid barium infection. And patient should eat foods rich in fiber such as fruits and vegetables, and that will help to elimination of barium quickly. And if I look at the image of this barium follow through, a very standard image. So here is the duodenum part, and this is the jejunum, this is the ileum. So all the small intestine are visualized very well, and there is a image of barium follow through, and it have a pathology. So you can see that there is a elongated narrowing of the ileum part or end of the ileum part. So this is a case of Crohn's disease on a small bowel follow through. In this case, there is a severe stricture of a long segment of the terminal ileum, and this is called a sting sign of Cantor. So this is the case of Crohn's disease, and you can see the another case of Crohn's disease, and in this case, a deep linear ulcers, and in the arrow sign you can see that ulcers are seen. There is two yellow arrow. These are the ulcers of the terminal part of the ileum and have filled with the barium in this stenoterminal ileum are known as rose-stone ulcers and are typical of Crohn's disease. So this is another Crohn's disease, a typical example. And then is the Meckel's diverticulum. So in this Meckel's diverticulum, so you can see that this is a small bowel follow through image shows barium filling of a blind ending tubular structure. You can see in the arrow, and that is arising from the ileum and is characterized by a Meckel's diverticulum. So these are some common pathologies of small intestine. So thanks for watching. Hope you enjoyed this video. So please give me a thumbs up and don't forget to subscribe my channel, and of course hit the bell icon to get the latest videos, and see you in the next video. Thank you.